Now, another one that we happen to be working on right now is medical records. Every time you go to the doctor writes out a medical record for you. And some are very simple and some are very complex, depending on why you went to the doctor. Medical records are certainly good for your own personal care. But even more important, medical records are important because of the fact that they form the basis for doing research. Now you say, "Gee, Bill, research. Why is that important?" Well, let me tell you something. Suppose you go to a doctor, and suppose you happen to have a series of conditions. You have diabetes, you have COVID, you have some other condition. And so the doctor knows that when under these series of conditions you have, he better treat you very carefully, because if he doesn't, he may make matters worse, not better. So, how does the doctor know how to treat you? And I asked my doctor this one time. In fact, let me relay the conversation. One day I was in the doctor's office, and the doctor said, "Gee, Bill, what do you do for a living?" And I said, "Well, I have technology that takes text and turns text into a database." And he said, "Gee, that's an odd thing to do. Why do you do that?" And I turned around and said to the doctor, "Well, let me ask you a question." I said, "When you have to do research, you got a patient that's got a bunch of important and strange conditions. How do you know how to treat that patient?" And he says, "Well, we go look in our library of patients in their treatment, and we try to find one that matches closely the person we're working with." And I said, "In your career as a doctor, how many records have you ever read in order to figure out how to treat somebody?" He says, "I don't know, maybe 15, maybe 20 records." And I said, "How would you like to be able, in the same amount of time, to look at 1 million records?" He said, "Don't you think that if you could find 1 million cases that are the same conditions as what you're looking for, the odds of an effective treatment for a patient would be better?" And he said, "Yeah, but I can't look at 1 million records." I said, "Yes, you can. If you turn your text into a database, of course you can." And he says, "Now I understand the importance of taking text and putting text into the form of a database." And so medical records, it turns out right now, we're doing the medical records for a country, not just a clinic and not just a doctor's practice. We're actually doing all of the medical records for a country. And when we finish, we're going to be able to write a query and say, okay, for all of the population of a country, for people that have had COVID, for people that have had cancer and heart conditions, what were the outcomes for treatment? And it's going to be a very powerful tool for the citizens of this particular country. So that's a little bit about medical. So when you take a look at medical records, this is an actual medical record. What do you find in the medical record? Well, first off, you find that it's in the form of text, and that's the first thing you find. The second thing you find is there's a wide variety of information in the text. So there's negation. By the way, negation, why would negation be important? Well, negation would be important because the doctor in your medical record say the patient did not have a heart condition. Well, that's an important piece of information, not because of what the patient had, but what the patient didn't have. And so negation, you better be sensitive to negation. Conditions, the person had lived in a house that the temperature gauge doesn't work, and so the conditions are the person was cold all the time. Medications, what kind of pills and drugs did the patient take in order to treat what was going on? Document sections, we have past surgical history. Has the patient had surgery before? diagnosis. And these are just some of the things you find in a medical record. And what you can do with textual ETL is you can take these medical records, search through them, and put in the important information that you want to find. Now, this is the only look we're going to be having at an output from textual ETL. But first off, this is a relational database. Note that this is a relational database. And these are the fields that you find in the relational database. And we had to block one of the fields out because this was the patient name, and these were real records. And in the United States, it's against the law to publicly disclose, even accidentally, a patient's name. So there's actually data there, but we blocked it out because our government told us we had to. The value of the relational databases, once your text is in this form, you can now look at millions of records. So who needs to be able to look at text using a database? Answer: restaurants, hotels, banks, telephone companies, doctors, hospital, pharmaceutical, airlines, government agencies, manufacturers, and the list goes on and on. But the truth is, everybody needs to be able to unlock the door of the textual, unstructured information in their corporation.